Well, for more on how funding is changing the fight against cancer, I spoke to Dr. Anupam Jena. He's an associate professor at Harvard Medical School. I began by asking him how much global spending on the disease has grown in the last few years.
It's grown considerably. If you look at cancer spending, let's say in 2015, it was almost $100 billion. Look back in 1990, it's probably 20% more than it was then, if not more than that. So spending on cancer has gone up considerably, both globally and in the U.S.
And is that mostly on the prevention side or the treatment side?
That's mostly on the treatment side. And if you look at, we've obviously spent a lot of effort on improving cancer screening. If you look at the gains in cancer survival over the last 30 years, I'd say about at least 50% of those gains have been due to treatment, and the remainder probably due to increases in screening.
And as you mentioned some of the gains, there's obviously a lot of initiatives geared towards both prevention and treatment. And when people are asking, what sort of payoffs are we seeing? You did mention some. What about other things like how it's affecting cancer rates or perhaps any new treatments that are coming out?
Yeah, so if you think about, it's hard to answer this question in a global context because there's a lot of countries where we don't have a lot of data. But if you just think about the United States, in the U.S., I would say 2 out of 3 cancer patients today can expect to live at least 5 years after a diagnosis of cancer. Now let's look back 25 years ago to 1990. That number was more like 1 out of 2. So we have made, I think, considerable gains in cancer, and most economists would argue that the value of those gains in life expectancy and quality of life have dramatically outweighed what we've actually had to spend on drugs for cancer and treatment for cancer.
Now, on the patient side, obviously one thing that people are always going to wonder about is the affordability of these treatments. Give us an idea of some of the costs that are involved.
The costs are quite variable. So for treatments that have been around for a long time, you might expect monthly treatment costs that are $1,000 or less. So these are for old mainstay treatments. There are even some drugs that can be taken by mouth. For some of the more novel and recent breakthroughs, the treatment cost could be in excess of $20,000 for a treatment cycle which lasts a few weeks. And so there's considerable attention being placed to the cost of cancer drugs, and I think rightly so.
And what about for companies that are creating these drugs? Obviously, they have to balance trying to keep these costs low enough so that people can afford them, but then what happens to their bottom line? So what are some of the incentives, perhaps, for companies?
Yeah, so I think this is the key question if you think about innovation in cancer and just innovation broadly. It's an innovation access trade-off, and what that means is that the companies require an incentive to innovate in this space, in this case oncology, but at the same time, higher prices could mean lower access to those therapies. And in fact, that's the entire purpose of the insurance system. The insurance system allows people to pay premiums for a large portion of their lives so that when they do get sick, they are able to partake of those novel therapies, which would be expensive if you had to pay for them out of pocket.
And when it comes to some of the countries that are at the forefront of trying to lead some of these novel developments, who would you say are some of the front runners?
I would say if you think about cancer R&D spending, research and development spending globally, the U.S. by far has the lion's share of cancer R&D. I think the estimates are variable, but you'll hear numbers between 60 and 80%. So more than 50% of research and development into cancer is done by the U.S., and a large chunk of that is actually done by the National Cancer Institute, the part of the NIH.
And when it comes to that role, as you mentioned, the government spending, what about the private sector? Are they working together? Is it more so governments that are stepping in?
No, I think there's actually quite a nice complementarity across most disease areas. The breakdown between public and private research and development is about 50%. A lot of the basic science discoveries happen through federal research dollars. Not all, but a lot of them do. And then the next step from taking a finding that you see in the lab to making sure it works in humans, that is a step that I think the industry has done really well at and is continuing to grow and perfect. But that's also an extraordinarily risky, time-intensive, and costly endeavor to make sure that we can get safe and effective drugs to the market.
And as we look ahead, if you were able to wave a magic wand and decide where you would want the bulk of the spending to go when it comes to cancer, where would you want it to go?
So I think the natural way to figure this out is really to try to determine where the burden of disease is largest. And so the way to figure that is what is the incidence of different cancers, and how mortal are those cancers, how deadly are those cancers. And in the U.S., lung cancer, breast cancer, GI cancers, colon cancers, for example, those are the places where we're seeing a lot of innovation, and I think rightly so, because the market sizes there are very large, and the number of patients that could be benefited is quite large.